Well, school is out for the summer. Warm weather is here. Summer break also brings different kind of breaks, injuries, and that often means broken bones. Now, our kids' bones need to last a lifetime, so proper treatment for broken bones really matters. Joining us today is Dr. Channing Tassone, an orthopedic surgeon at Children's Hospital of Wisconsin. Doctor, how can parents know if a child's injury is really serious, despite what I think is the obvious, them screaming in pain?
Right. It's an excellent question. Broken bones aren't always totally obvious, and certainly there's kids that end up in my practice after they've still been playing soccer or doing athletics on a broken bone. So really what we would encourage is any time a parent thinks their child has an issue that's enough that worries them, by all means it should be checked out and let us take a peek at it.
I think the temptation for parents is to move the arm or leg up and down, to do a lot of feeling in there on their own. Can parents do more damage by doing some of those things, or are those good checks?
They're certainly not going to do more damage. I wouldn't want people to worry that they're going to do something terrible, but to say that they'll be able to know by feeling with their hands and know definitively whether or not it's a break, that's pretty tough. So
then the choice is always, do I go to my child's doctor's office, do I go to urgent care, or all the way to the ER? And your recommendation would be?
Right. Well, I think the important distinction isn't necessarily what physical location you end up necessarily, but making sure that when all is said and done, the kids get the absolute best care. And that's where I think the really important message is, to make sure they get their care from us at Children's.
And we know that even other medical groups often do say kids should go to Children's.
Right.
Does that usually start with a visit to their local doctor's office, or should parents just go straight to Children's?
Yeah, like you suggested earlier, it really depends on the severity of the injury. There are certainly a lot of what parents would perceive to be minor injuries that are perfectly appropriately taken care of in the pediatrician's office, and then as their level of concern gets higher, there are urgent cares, there's the emergency department. I think one of the things we're working very hard on at the Children's Orthopedic Clinic is that we have really increased our accessibility to make sure that we make it absolutely as convenient as possible for parents to get their kids in to see us so that we can help them at any time.
And doctor, we have just a few seconds left. Kids breaks different from adult breaks. How?
Absolutely. Really two fundamental differences. Kids have growth plates. Kids' bones obviously are growing throughout their life, and if a child breaks in a growth plate, that can have long-term impact on the form and function of their arm or leg. And so with our experience at Children's, we can make absolutely certain they get the best care and they don't have problems in the long run. And then also there are a lot of injuries that if you or I were to have the break, it would be an absolute definite surgical need. And in kids, there's a lot of times they can do great just with a cast, and because of our experience at Children's, we can oftentimes keep kids out of the operating room. The vast majority of the injuries we take care of don't need surgery, and making sure that no kids are exposed to unnecessary risk from having surgery is the other thing we can help a lot with.
Yeah, kids can bounce back in a hurry. Dr.
Exactly.
Channing Tassone, thanks so much for being with us here on Live at Noon. Appreciate it very much.
Thank you.